Hi guys, welcome to DrTshares IGTV channel. So it's been some time that I've uploaded all my medical online tutorial videos, but I guess it's not too late because I'm here again with a very interesting diagnosis known as Wandering Spleen, or it's known as splenoptosis. So this wandering spleen basically means or defined as a change of your spleen's position from one to another, or literally a displacement of your spleen, right? So your spleen is basically located at your left hypochondrium area, which is your left upper quadrant of your abdomen, and this spleen is basically held by four principal ligaments. Okay, get your anatomy right. So we have four main ligaments that literally holds your spleen right in place, which are your gastrosplenic ligament, your cholecosplenic ligament, your renal-colic ligament, as well as your splenorenal ligament, right? So these are your four important ligaments that holds on to your your spleen in place. Yeah, it looks like a tongue twister, but medical students will know this better, right? So if these particular ligaments are weakened or it is malformed, then it causes this wandering spleen, which means that it becomes loose, where it doesn't hold or grip on your spleen in a proper position, and therefore your spleen moves from one place to another. Okay, so this is a very rare medical condition. It doesn't happen to everybody just like that. It's a very rare condition where it affects young children at birth. All right. Other than that, it could also happen in adults, especially women after multiple pregnancies, or adults who have undergone any trauma towards the abdominal region, any crush injuries. So in this kind of cases, it leads to a weakened ligament or a malformed ligament, causing your spleen to wander around your places. Okay, so of course in your mind you'll be thinking, so what could be the symptoms of wandering spleen? If it changes from one place to another, it wouldn't cause much problem. No, that's where you're wrong, because that's where your spleen tends to move around and it goes and give you pressure effects. If it gives you a pressure effect towards your bladder, it leads to urinary retention. If it gives a pressure effect to your colon area, it gives you a constipation. Or if it blocks important arteries, you have big arteries around your spleen area. You have your splenorenal artery, you have a lot of arteries, that your gastrosplenic arteries. So if these arteries are being affected, it causes infarctions, it causes ischemia, even causes you splenic infarctions, and it causes pseudocyst formations, pancreatic infarctions. So this could be the effects of pressure effects. All right, it causes blocking of arteries. In fact, it could also lead into torsions, right? Splenic torsions, because of the change of this position. So this is also patients literally comes with acute abdomen. So it's really very hard for doctors to judge if it could be wandering spleen unless a medical imaging test is done, right? Such as CT scan, MRI, ultrasound. So later I'll be sharing you one simple picture of an ultrasound which shows wandering spleen. So in case you have any trouble looking into it or probably interpreting it, you can always DM me and I'll try to help you as much as I can. So as I told you, patients do come with acute abdomen and they do come with hypersplenism symptoms, all right, because literally your spleen tend to enlarge due to the change of its entire the position. All right, so this is basically how a wandering spleen looks like to you. But asking about the diagnosis, of course you diagnose this spleen issue, this wandering spleen, by medical imaging, as I told you, and this is of course known as a medical emergency. And if at all your spleen gets into torsion, so of course it becomes not only a medical emergency, but it becomes a surgical emergency where you need to do a detorsion, right? Or even a splenopexy, unless if it has caused severe splenic infarction where your splenic tissues are not viable enough, your parenchyma is totally gone, out of blood supply. So in this kind of case, of course, you need to do an urgent splenectomy. Okay, so keep in mind that this is mainly a surgical intervention. So patients with wandering spleen, we can keep this as a very end or the very last differential diagnosis. So if you see patients, a susceptible patient who comes with you with acute abdomen, you can have this wandering spleen as your very last option. Do not put it as your first differential diagnosis. Your consultants might kill you for that. So I hope that this wandering spleen could give you some what do you call, some kind of information. And if at all, if you find patients who are very susceptible to this wandering spleen, at least you could think of this diagnosis, right? So do not skip this, as this is also a surgical emergency. So I hope that this video has helped you so much about this wandering spleen. As I told you, I will share you one ultrasound picture, and if at all, if you have trouble in interpreting that picture, you can always DM me and I'll definitely help you out, right? So that's it from me then. I hope you have a good day and take care. Bye.